Welcome to part 2 of our 2-part series on Achilles tendinitis. If you haven't seen our first video, make sure you watch that first. Be sure to stick around to the end where we give you our top tips on how you can start your recovery today. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links we mentioned in the video can be found in the description below. As always, this information is meant for education and demonstration purposes only. With that out of the way, let's get into it. As there are few markers of inflammation in Achilles tendinosis, you need to treat the collagen degeneration and not inflammation. In fact, some treatments to reduce inflammation are contraindicated with tendinosis. Ibuprofen, for example, is associated with inhibited collagen repair. Corticosteroid injections have been shown to inhibit collagen repair and increase the rate of Achilles tendon tears and ruptures, with risk increasing with subsequent injections. Knowing what you know now about tendinosis and its lack of inflammation, injections for Achilles tendinosis don't make much sense. Any modalities designed to reduce inflammation are essentially pointless. Iontophoresis, ultrasound are a waste of time. If anything, ice could be tried as it might potentially have effect on the neovascularization that's associated with tendinosis. Just be aware that this can also limit your ability to detect pain and can result in overloading the tissue without knowing it. The use of Healis is based off of some really low quality studies. There are no high quality studies that support it. In fact, some small newer studies have reported that there is an increase in Achilles tendon tension with their use. While appropriate for post-surgical repair of Achilles tendon, their use for Achilles tendinosis is not currently supported by evidence. Orthotics have just never stood up to the scrutiny of research. They are way overprescribed. There is no evidence that foot alignments such as pronation, supination, flat feet, high arches have any impact on the increase of foot, ankle, knee, hip, or back pain. If you still really want them despite the fact that research proves that they do not do anything, just get a store-bought pair and not custom ones. They do just as well. The quality of evidence for or against shockwave therapy is not great. Several studies have shown to be no better than placebo, while others have shown some improvement. The use of shockwave therapy currently lacks the quality and consistency to support its unconditional use. The research is clear that it should be considered as a last-ditch conservative option, especially as it is expensive and not covered by insurance, and with how painful it is. It should be used for those that have failed to respond to appropriate conservative care within 6 months. The evidence is not great for their use, especially in a person who can tolerate partial or full weight bearing on their foot. While it can allow for tensile load to be applied with no weight bearing and without having to do anything, in my opinion there are plenty of ways to modify stretching or load to make it tolerable. Again, not a lot of good research out there just yet. One study found improvement in the 2-year follow-up, but 2 studies found 53% and 57% satisfaction at a 6-month follow-up. Not really strong enough at this point to go all in on. Despite common belief, these techniques in no way will change Achilles structure, break up scar tissue, or release adhesions. These things do nothing to change the tissue structure. They could provide a stimulus that can temporarily change a patient's perception of symptoms, but this can also be achieved by a patient through exercise. If you want to do it, fine, but just remember you're not changing anything structurally. There are a number of surgical options including open debridement and decompression, endoscopic or minimally invasive procedures, flexor hallucis longus tendon transfer, and gastrocnemius recession. Open debridement and decompression have good post-operative outcomes, but there are risks of infection, scarring, numbness, skin necrosis, blood clots, and recurring pain among others. Endoscopic surgery also has good outcomes, but still a risk of infection, altered sensation, and scar sensitivity. A flexor hallucis transfer is used to support a severely degenerated Achilles tendon, but does best with people over 50 years of age. To date, there is no evidence that a tendon transfer has any better outcomes over debridement. Gastrocnemius recession has a shorter recovery time than debridement. However, there is a loss of plantar flexion power, and there is insufficient evidence to recommend it as an isolated treatment. I always wonder if the recovery is generally pretty good with surgery because of the actual surgery, or because after surgery you actually are forced to do what you should have done in the first place. Unload it and then gradually apply progressive loading to it. It makes you wonder. In any case, all surgical options should be considered as an absolute last resort. Exercise is one of the best and easiest interventions you can do. Applying load to the Achilles tendon stimulates new collagen growth, increases the scaffolding that binds the collagen together, and helps align the new collagen. All of these things result in stronger tissue and higher tolerances to tensile load. The tissue will continue to adapt and increase provided it's progressively loaded. Interestingly, when new tissue is grown, it does not replace or repair the degenerated tissue, but will grow around it, encapsulating the compromised tissue. So what should you do? Well, that's going to vary greatly depending on the severity of your symptoms. With exercise, the key is to start low and progressively increase the amount and intensity of exercise over time. To learn more about the specifics of increasing tissue tolerance, check out the link in the description below. Exercise choice and intensity will depend upon what the Achilles tendon can tolerate. An Achilles with high sensitivity will need to start with a different set of exercises than someone with mild symptoms. There are a number of ways to change the intensity of exercises. Exercises can be increased in intensity by adjusting variables including duration, level of weight bearing, speed, sets, repetitions, range of motion, and frequency. Rather than go over every exercise here, we'll put up a video of the best exercise, which once completed we'll link below. If you have pain at rest, meaning it hurts all the time, not just most of the time, I mean all the time when you are awake, you must unload or deload your foot. It means that you are highly sensitized or in the inflammatory phase of tendinitis. The tissue has very poor tolerance to force. Even just walking could be too much force and cause more damage, delaying recovery. Depending on the severity of the damage and the associated decrease in tissue tolerance, you may not be able to put any weight on the foot at all, or maybe it can handle a little bit of stretch and you could use a crutch. It's going to vary from person to person. Only you have the ability to figure that out. Keep in mind that the action of the muscles that form the Achilles tendon is plantar flexion, which happens every time you take a step, go upstairs, or stand on your tiptoes. It's hard and it sucks, especially if you're working or have other responsibilities, but it's crucial to give the tissue time to move through the phases of healing. Unload it, don't stretch it, don't rub it, don't try and walk it out. Rest and unload until your symptoms become intermittent, meaning no pain at rest in an unloaded position. It will serve you better in the long run. The key to achieving full recovery, as with any goal, is to stay consistent and work on it every day. Don't look for quick fixes, a miracle pill, or an ointment. They are not supported by evidence. If you're going to use them anyways, make sure they are a supplement to the meat and potatoes of recovery, which is consistent and progressive loading. They should never be used as a replacement for the core work that is required. Tendinopathies take a long time to become pain-free, with pain improving around 12 weeks and full recovery taking around 24 weeks if it is loaded progressively and appropriately. It takes around 7 to 10 days for tissue to start to adapt, so don't expect drastic changes right away. If it is true Achilles tendinosis, it won't happen. If you're very active prior to injury, expect to have a slightly longer recovery. It takes more time to get your tissue to tolerate higher forces. The stress walking to the mailbox is nothing compared to a marathon runner or a triple jumper. Logically, it will take more time to return to those activities. Without a doubt, you're going to get frustrated, but if you stick with it, you will recover. Progress slowly. Don't rush your recovery or your return to your previous activities. If you try and return too fast, you will likely dump yourself back into the inflammatory or highly sensitive stage and have to start all over again. Your body and tissue will tell you for progressing too fast. Slight pain during exercise is okay, as long as it fades away and you're back to baseline the next day. Pain does not always equal tissue damage. For example, if you walk for 5 minutes on one day, wait until the next day to see how you react. If your body can't tolerate the 5 minutes yet, it will be painful and sensitive the next day. So take that day off and make sure your symptoms are intermittent before trying again. Next time, try walking for 3 minutes and then wait and see how you feel the next day. As you progress slowly, your tissue will adapt and get more tolerant. Keep in mind that any stress placed on your foot is really an exercise and contributes to the daily cumulative amount. Be aware that if you're tolerating 10 minutes of structured walking for 4 days straight, and then all of a sudden you get increased symptoms, it's likely going to be something other than the walking that caused the flare. Maybe you carried something up and down the steps, did some gardening, Who knows, but think about any possible increased activity you did the day before. When dealing with a load-bearing structure like the foot, Achilles, knee, or hip, just standing or walking to the kitchen or the bathroom all count as exercise. They all place stress on the structures, in this case the Achilles tendon. Keep that in mind throughout the day. It all counts and could be the reason you're staying painful. You could be overdoing it and you just don't realize it. Every day you put off changing your nutrition and exercise habits is one more day in the wrong direction. Improved nutrition, exercise, and the associated changes in body composition all help decrease chronic inflammation levels and improve not only tissue health, but health in general. Thanks for watching. Before you head out, please hit that like button, share us with your friends. Be sure to click the subscribe button and the notification bell so you don't miss our video on the best exercises for Achilles tendinosis, and we'll catch you on the next one.